I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More Here.
Hello and welcome to this episode of IDD Health Matters. I have with us today Dr. Alice Bacherini.
Correct.
Did I get it right?
Great.
Good job. Where are you from, Alice?
I'm from Italy.
Okay. So Alice, tell us what you do in this field of IDD supports and services.
Okay. Yeah. Of course. I am a postdoctoral research fellow at the University of Perugia in Italy. That is a city, very small town in the center of Italy. So just to give you a bit of context, it's a very rural, and it is in the region of Umbria that is called the Green Heart of Italy.
Okay, nice.
Yeah.
Nice.
I have a background in psychology in the field of psychometrics, actually. So basically what I do, I developed or adapt psychological tests to measure several constructs in the field of ID. So, for example, adaptive behavior or erroneous assumptions of physicians toward intellectual disability.
That's important.
Yeah.
Yeah. The
Absolutely.
assumptions that we make as clinicians.
Yes, because I know
Yep.
that they can contribute to the healthcare disparities faced by people with IDD. So basically, I study also the interactions between individuals and environmental factors on aspects related to the healthcare of people with IDD, their living skills, quality of life. So I am interested in all the aspects that can affect and, on the other side, improve the quality of life of people with IDD.
And is your research primarily in Italy or is it in other countries around the world?
It's both in the U.S. and in Italy, because I'm lucky to say that I have some connections in the U.S. That I had the chance to make during my doctoral program, because it was an international doctoral program that took me a year abroad at the Ohio State Nightingale Center. So,
Wonderful.
Yeah.
So I've had the opportunity to participate in some of your projects. Let's talk about that a little bit. Tell us about that project and maybe some of the outcomes that you found so far.
Yeah. Recently, during my PhD, actually, I developed two new instruments targeting, let's say, physicians' aspects, okay? One is erroneous assumptions of physicians about adults with ID, and another one is a scale measuring self-efficacy of physicians in caring for their patients with IDD. So we realized that there were no instruments targeting these aspects, but they are important aspects.
Definitely.
So the first point, we have to start from a correct measurement to know the areas that warrant an intervention. So in a case, dismantle erroneous assumptions, and in the other case, improve the self-efficacy for caring for adults with IDD. So we, of course, reviewed the literature, we wrote the items, and we conducted the validation studies. And we now arrived at the final versions of the instruments. So
yes.
I'm happy to say that the instrument that measures erroneous assumptions of physicians about adults with ID is already published, and the scale is available, so it can be useful and used by researchers or medical education practitioners and so on. So you can use that to detect the areas of erroneous assumptions that represent biases for physicians and say, okay, you have a bias here. Let's give you the right information about ID and people with IDD. So you will overcome your bias and you will be more confident, and your quality of care will not be biased anymore.
That's quite an accomplishment to develop that and have it validated.
Yeah.
Has it been used yet?
In my dissertation. Dissertation.
What are some of the findings? What are some of the areas that you found?
So I investigated one of other the validation studies of these two instruments. I studied in males and female physicians separately. Some of the factors influencing erroneous assumptions, self-efficacy of physicians, and their positive attitudes toward intellectual disability. And we found some interesting findings, like the relationships between erroneous assumptions and attitudes toward intellectual disability. So higher levels of erroneous assumptions were associated with more negative attitudes toward AD, and also higher levels of self-efficacy were associated to higher levels of positive attitudes toward AD and lower levels of erroneous assumptions. And interestingly, we investigated the relationships between these factors and social dominance orientation, that is the preference for hierarchies between groups. So they're thinking that one group is more valuable than another group.
Okay.
And
so explain that again. You said that, what was the correlation with that thinking, that hierarchy thinking?
It was a positive correlation with erroneous assumptions. So higher levels of erroneous assumptions were associated to higher levels of social dominance orientations, and with lower level of self-efficacy and more negative attitudes toward AD.
So the question is, how do we combat those things? How do we improve those situations? Do you have any tips?
Yeah, that's just my opinion, not a right answer.
Sure.
I think ID training would be the key. But ID training, not just like academic training, but really the real interactions with people with IDD. Because we know that some studies show the powerful of physicians interacting and spending time with people with IDD. So knowing their characteristics and see what persons with IDD can really do in their lives. Dismantle the bias toward this population, and I think this is the key.
Well, I couldn't agree with you more on the importance of training for clinicians, but really anyone who works in this field to understand so many different concepts. Certainly you need good clinical and diagnostic skills, and there are some different techniques that clinicians can learn when working with people with ID, and then also just understanding how to communicate and presuming competence rather than presuming incompetence, and things like that make a huge difference.
But also consider, if a person with IDD come to a medical appointment with a caregiver, the physician should refer to the patient with IDD, not go directly and asking questions and just talk with the caregiver.
That's right. Talk to the patient first. And caregivers can supplement as needed, but really talk to the person first.
Recognize his rights, his self-determination.
So if people want to find that tool that you mentioned, how would they go about finding it?
So I have 2 published papers about the scale of erroneous assumptions of physicians. They are published in the Journal of Intellectual Disability Research, and the name of the scale is Beliefs About Adults with ID. The acronym is BAAID.
Okay.
And it is also publicly available on the OSF platform, the Open Science Framework.
Wonderful. Okay. Excellent.
And concerning the scale about self-efficacy, we are in the in the making.
Not quite done yet.
Yeah, the study, the validation study, development and validation study is done. We are in the making of
So
the
look for that
publication.
soon.
Yeah,
Yes.
hopefully.
Coming to a journal soon.
Yeah.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
One of the questions I always ask guests are, what 3 tips, what words of wisdom, what advice do you have for listeners that you think can improve health and wellness or the world for people with intellectual and developmental disabilities?
Give people with intellectual disability the chance to meet you and speak. So listen to them and engage with them.
Very important.
And the second, it's kind of related. Keep you informed. I mean, don't be shy to know. Don't be aware that diversity really can enrich people.
I love that.
So,
yes.
Yeah. And the third, probably it is related to the other two, but really keep you informed, keep you curious.
Inquisitive minds about how to improve services or systems. Those are wonderful things. So, Alice, I've enjoyed having the opportunity to work with you, and I really have enjoyed the opportunity to talk with you today. I really appreciate you taking the time to be on the show, and especially for the great work that you're doing.
Thank you, Craig. It's a pleasure
Thank you.
of mine always. Thanks.